Next panel discussion is addressing burnout, promoting staff well-being in the midst of healthcare labor challenges. It's going to explore the practical ways to address burnouts, from promoting staff well-being to creating supportive workplace cultures. This is not just about reducing stress, it's about helping the healthcare workers thrive so they can continue what they do best, which is, of course, saving lives. So our moderator for the session is Ms. Laurie Ellington, the CEO and founder of Ancient Science. And on the panel, we have Dr. Heinrich Zinnemann, as well as Dr. Clint Steele and Dr. James Judge. So please put your hands together and welcome our moderator and panelists.
Good afternoon, everybody. As you've probably deduced, my name is Clint Steele. I've been nominated to moderate this particular conversation. And we will, as was mentioned, we'll be talking about burnout. Just to give a little bit of context, once again, I looked at some literature reviews. And as I mentioned this morning, I looked at the literature reviews for remote patient monitoring. And some of those review articles, even though they'd only been written 1 year ago, had about 200 citations. I did the same thing for articles dealing with burnout in the medical space. And these were review articles written about 1 year ago, and they had citations around about 7. We all know that burnout is a thing. We need to deal with it, but the interest does seem to be quite low. So I'm hoping at the end of this session, people will be motivated, if you are in the research space, to research a little bit more, but you'll also know a bit more about the definitions, things like that, and we'll hopefully fill in some of those gaps that seem to be there. And to get things moving along, even though this might be preaching to the converted, we do want to talk about what the effects are, and also how do we define it. And I'm going to put that question first to Laurie. To tell us, like, you know, what are the effects of burnout and what sort of definition do you take when you're looking at burnout?
Yeah, thanks, Clint. Yeah, I really look at the physiological markers of burnout because they're objective. And what we know is that burnout is really the prolonged activation of the physiological stress response. Key word here, without recovery. So all of you have a cell phone, and every time you're checking your email or checking an app or looking at your WhatsApp or whatever's going on, you're using that battery. And once that battery is gone and there's no charger, it's out of energy. And that's what happens with burnout without the recovery process, because we're batteries. Humans are batteries. And so what happens with that prolonged activation of the physiological stress response is key networks in the brain are reorganized. So with burnout syndrome, there are changes, structural and functional changes in the central nervous system. And it's atrophy and deterioration of brain networks that are associated with self-regulation. So it's a significant loss of self-regulatory capacity. The prefrontal cortex is damaged with burnout. The emotional primal centers, subcortical in the brain, are enhanced and grown, such as the amygdala, for example. And so it damages the brain. And then also throughout the autonomic nervous system. So it's really a mind-brain-body network reorganization. And these are measurable biomarkers. So we know, for example, with the autonomic nervous system dysregulation, that the vagal tone is decreased. This is really important because there's a loss of balance between the rest and digest branch of the autonomic nervous system and then that fight or flight. Heavy on the fight or flight for a while, lots of cortisol, hypercortisolism. Then a decrease into hypo, and that's when you see the fatigue. There's also cellular damage, mitochondrial dysfunction. That's where we're getting the fatigue from. Increase in inflammatory cytokines, creating inflammation throughout the whole mind-body-brain system, particularly in the central nervous system. And of course, if we got a brain on fire, we got a shrinking brain. So I look at it from the neurobiological components, and I think that that's helpful to understand the mechanics of it versus just the subjective measurements of burnout.
Thanks for that, Laurie. Heinrich, did you have anything to add to that definition that Laurie had put forward?
Maybe more on the psychological side. There are some symptoms like the loss of sense of meaning, you work and you don't know why you work and what it is good for. And a loss of sense of coherence. You don't ally with what is outside of your personality and your surroundings with what you do.
There was a review article that actually looked at the connection between burnout and religiosity or spiritualism, and they did say that one of the signs of burnout is when you feel as though your purpose has gone, your importance has gone, which I think is a very important aspect of most spiritualism. You have some kind of value, and it was interesting to see the parallels between, it's almost like when you're experiencing burnout, and I know this is not measurable, but it's almost like your soul is being sapped. And people say that, that's what they say, it's like my soul is being sapped, and that's what it feels like. So that's probably one of the signs of approaching burnout. And I guess the other thing I'd like to talk to you about, Heinrich, is the way we define burnout. Because I mean, there is that colloquial sort of description where people say, I feel burned out, but in reality they're becoming fatigued or they're becoming stressed. Yeah. But what would your definition be for somebody who is actually suffering clinical burnout?
Yes, in colloquial talk, managers often say, I'm near to a burnout, and this is not the clinical definition of burnout. So there are questionnaires which allow to diagnose, and I think Lauren could say more about this, of these questionnaires.
Sure, let's pass on to Lauren.
Yeah, just real quick, the most popular one, the Maslach Burnout Inventory. She was really a pioneer in moving that assessment forward. The Copenhagen Burnout Inventory, the Oldenburg Burnout Inventory, those are three really popular ones. Of course, these are subjective measures, right? But they are validated and reliable in the literature, yeah.
And certainly the reviews did indicate that they are subjective and there can be some volatility to the way they are measured. I guess we've spoken a bit about what the effects on the individual, but I think, James, you probably got some more insights on the individual as well, but also at, an organisational level as well, what the effects of burnout can actually be.
Well, part of the, it's like in my system, I'm physio, so we have 12 offices in the Chicago area, and so we have a lot of therapists that work in there. And so we are competing heavily in this industry with companies that have been bought out by portfolio companies that are hedge fund companies. So what they're doing, they're grabbing therapists into their system, and they're all about metrics. So these metrics that they're finding is to really push these therapists really hard. So what I'm finding is we're having therapists come through our system that have already been to the mill, and they're beat up, so they're almost gun shy before they come into our system, is because their self-worth is down. And I can't compete with Jeff Bezos owns Amazon. He's also pulled in therapists into the workforce of Amazon to help their injured workers on site. They used to come to us. So we're fighting a big fight with corporate America, and these therapists are just a pawn. And that's a real difficult problem for me to deal with, because now I have to deal with the psychosocial issues that are here. So we do a self-inventory on our therapists when they come in the system, because we almost have to talk to them. That's a battered wife syndrome by the time they get to us. And so what we're trying to do is get them to a point, where you were, what happened, how can we make this better for you? We always try to do that first. So and then we have an exception. Here are our standards of care, and this is what we're going to do. And we have a very one-on-one based model of care, because the metrics are important, our outcomes are even more important, and then we try to go from there. So we see that we're fighting, and then we also have an educational program. I bring in the best therapists across the entire world that come to our office on a monthly basis, so they get free training for them. So the physios are better, so we give them something different. We're not going to burn them out. We're not going. When I was a kid, burnout meant you smoked a lot of pot. It's not like that anymore. But the issue that we're trying is to watch them, and I think some of the surveys that he was talking about is something we do early on as well. But we're fighting a fight against corporate America, and I feel like we're winning because our retention rate is great, because we check on them on a regular basis, and it's been very rewarding for me, because this is the hardest job I've ever had to do in 35 years in this business.
When you say you check on them, is that an objective measure, like for surveys or something like that, or is it?
Well, we developed, I'm the CEO of the company, but I have a roundtable discussion, so I have all the leaders come to me. I let them tell me what I'm doing wrong. It's kind of hard to do, but I do. What are the things that they need to help them better? So, and we also we have a survey, we actually have a survey of 15 questions, and ask them specific questions. I'll see stuff like somebody who's leaving work early has a high cancellation rate in their patients. Because they have high cancellation rates in their patient care, that means their affect is low. and the patients aren't feeling, they can go to a health club, they go somewhere else, right? So we look at those type of models and come back to them, and we're reporting. We talk to them on a weekly basis. So we're checking with them on a very regular basis. And I feel like my leaders in my team and my director of operations, who is an active therapist, is in the trenches every day, making sure that they're okay.
Gotcha. With regards to measurement, and I'm going to put this to everybody here, if they would have some recommended approaches. If there is anybody in the audience here who's running a company and they want to measure burnout in their staff, what do you think some options are that people have that they could use? I'm going to start with you, Heinrich, because I know that you've got some expertise in inferring stress from other types of measurements and things like that.
I work as a coaching psychologist in a hospital, and my clients are employees, health professionals. And basically, I see two main measures. One is time scheduling, time management, and the other is relaxation. It's hard to get a surgeon to make a break during the day. Normally, they have no breaks, and it's a big success if I attain this goal, that they have a break of half an hour in a 10-day day, 10-hour day.
Mm-hmm.
Yeah.
So from your perspective, it's more of a, if you measure the behaviour and their scheduling, gives you a better, from that you can infer the burnout that they might be likely to experience in the future.
We try to prevent, of course, burnout, and if somebody is in a burnout, then he or she goes to a clinic. He cannot work any longer. So this is
Yep. It's a
after
very
my
strict,
work.
a very strict definition of burnout there. I guess to Laurie and James, just to expand further, if you were to recommend a particular way of tracking the potential for burnout in somebody's organisation, what would you actually recommend people here consider?
Well, you can definitely use subjective assessments, but I find it interesting that we talk about wearables for the patients, but what about the healthcare staff? What about having them have wearables? So they're tracking things like their heart rate variability, right? Just their heart rate throughout the day. If they don't know what's going on with their nervous system as it's becoming damaged, then they're not really getting that real-time data. I think biofeedback could be really powerful. So where you get a mix of subjective and objective measurements of burnout. Those are a couple of ways that I would recommend.
I got my own.
You got your own.
We use a questionnaire, like I said before, and we do check on our therapists on a regular basis. We do offer, after a period of time, we do a lot of outing events and things like that to keep them out of the clinic. And we also do have systems in place where if we have somebody who's not having a good day, we will have them have a personal day. We'll have them leave, and I'll cover actually for them, because we feel like we have to watch them. And they know we're doing that for them. So that's a big part of what we do for part of our profession.
Gotcha. Excellent. So I guess that's given everybody an idea of how they can measure burnout in their own company and prevent it from becoming an issue. I guess the next thing is, if you have measured burnout and you think it's a problem, well, what are you going to do about it? Where is it coming from? And so I guess that's a question I was going to put to people here about those the sources of burnout in the medical space. And I sometimes think, coming back to you, Heinrich, it could also be the attitude, and I'll come to you after this one as well, Laurie, because this is something that you were speaking about earlier, was the attitude of the actual person suffering the potential burnout. And you're saying that doctors are notoriously difficult to deal with in this respect.
That's correct. They know everything about the physiology.
They don't need to be told, do they?
They even know what to do, but they don't do it. They just don't do it. So.
And I guess to take it a bit further, they don't do it. Have you found any approaches that help people, particularly surgeons, say, to actually take action?
Yes, I think one possibility is to establish a ritual, a morning ritual or a high noon ritual, where they calm down for half an hour or quarter of an hour and do some technique like autogenic training or meditation or the like, breathing method.
So effectively, we can't trust these surgeons to do it themselves. We need to take care of them.
That's right.
Good. Okay. Yeah, that's what they're like. Laurie, I was going to say, any thoughts you've got on the sources and also what people do to themselves and their attitude that could contribute to that?
For interventions?
Even before the interventions, what are the sources? Why are people feeling burnout?
The literature really reveals that loss of agency and control. So like with your schedule, for example, overworked. I mean, this is intense emotional labor. So it's a massive energy expenditure. And when you don't have autonomy and control, then that actually really activates the pain networks in the brain. We know from social neuroscience that not having autonomy and agency fires up regions in the brain just as if you're being hit over the head by a 2x4. So it's just massive pain, and that's activating that physiological stress response. So I think that's one of the biggest things, and that can simply look like people having some level of control over their schedule, or their patient load, or even how they work, what time of day they work. I think Heather was mentioning that this morning. I think it was her, that maybe you perform better in the morning, or you got a duty to your family or whatever, and you want to take care of it during that time. So that can be really helpful in preventing. Did you want me to talk about treatment as well, or intervention? Okay, we'll get there. I think the sense of agency and control is huge to prevent that cynicism. That's such a key ingredient in creating challenges with decision making, particularly ethical decision making. One more thing, I also think that training in compassion. And we really need to look at the nuances between compassion and empathy. There is no such thing as compassion fatigue. That has not been found to be a credible label from neurobiology. We know that the symptoms are real, but it's actually empathic distress fatigue. So compassion is the antidote there. So the more that healthcare providers can learn how to shift from a state of empathy to compassion is going to decrease that stress response, because they're not feeling with, they're feeling for the patient, and there's a healthy boundary there. So one of the tools that I use and recommend is I integrate ancient ancestral wisdom with modern neuroscience. And so I use loving kindness meditation, and I might pair that, for example, with some heart rate variability training, or even you talked about some mind-body medicine practices too, such as autogenic training. Got your own.
Just before we do, I think that was a very significant point that you raised there, because I'm assuming that a lot of people in this room probably think empathy is effectively part of the job description. You think you're meant to be empathetic with every person who comes through the door. And a lot of if you're working in the medical space, you might have staff who think that way. And as we've established here, it literally could kill you. It just overwhelmed you. But that doesn't mean you have to be cruel, you have to be compassionate. And what I've always found that sometimes it's not getting the new idea in their head that's the difficult part, it's getting the old idea out. And to tell people, like, you're not meant to be empathetic, you're meant to be compassionate. And I think that is a definite take-home. If you're not familiar with that, there's a definite take-home that I think should be noted here, that people can be aware of that, because I think also something you were saying earlier, if I recall rightly, there are people who even believe that they shouldn't be feeling burnout either, like as part of their identity. I think Heinrich might have highlighted that a bit earlier as well. Do you believe there is a correlation between people who are empathetic but think that they should be able to maintain this level of empathy without actually suffering the effects? Is that something where some people effectively do this to themselves based on the way they think they should be?
Yeah, I give and give and give. And, it could be, usually these things stem from childhood, that's where you found your meaning and your purpose. But compassion is a skill. And we know this, these are physiological states. They use particular brain regions. Just to piggyback on what Heinrich said about purpose and meaning, compassion actually uses very similar networks as the purpose networks in the brain, whereas empathy doesn't. So some of it has to do with just you feeling like this is my purpose and my meaning, to give and not take care of myself. And then some of it has to do just have you been trained, and are you skilled at compassion? Just like, are you skilled at gratitude? Are you skilled at joy? Are you skilled at happiness? These are skills, these are habits that we cultivate. And I think when we start seeing them from that perspective, they're not personality traits so much, then we can just train. We can train for moving from empathy to compassion. And it's not that we don't need empathy. Empathy's the glue that holds the human family together. But you don't want to hang out there for long in the face of human suffering. It will take you down. You will burn out, like an electric pump without water, basically. Yeah.
Thank you for that. Yeah, sorry to cut you off there, James. I guess some of your thoughts on the sources, but I guess also if you could expand more on some of this commercial side that you seem to have a bit more expertise in than other people on the panel.
That's the big giant we fight every day. But for us to kind of be in a small mid-market community is important for us. So we'll do like we changed our EMR system, for example, to lower the scope because the documentation is a big deal. We lowered our caseload to help our therapists to reduce the stress. I have found that the millennials and Z generations are the ones that they can identify things faster than the older generations. My work ethic was to work. We don't think we have burnout, but we're suffering from burnout. We just don't want to say it. But the younger ones identify it quicker, and so I do use a compass in our office to make sure that we're identifying people that are tired or fatigued, and we do a lot of data to look at that, not small data. To make sure that they're doing fine, and I measure by how the Google reviews are, what's the satisfaction surveys doing, are they late coming to work, are they having a lot of attendance issues, and we start seeing any kind of pattern like this, then we immediately move in on it as fast as possible to make sure that we're there, and they know we're empathetic. That's the first question they ask you in physical therapy school. What's the definition of empathy? So we didn't know compassion yet. We learned it later. But it's important to make sure that we identify that so that we can keep these guys going. And their productivity is good, so it's been very helpful so far on a small scale.
Now you were talking about Jeff Bezos buying up a number of physio clinics, and you were saying that corresponded with burnout in some of the staff there. What is it, and if you mentioned some of the things you're doing, you think they're all the things that I guess aren't happening in those more corporate clinics where you said the physios are coming from who were burned out? Nobody's really paying attention to them, they're just being worked hard and treated more like a factory line as opposed to being treated like a medico?
Well, exactly. What it is they're actually working on site at the Amazon site, so not actually a clinic. They have a clinic inside.
I misunderstood.
Yeah, but they're drawing really good personnel out into the systems for the almighty dollar, and sometimes they figure. I've had patient therapists come to me and say, "I'd rather work for you. I'm competitive, but we're not paying their dollars." And they're like, "Because you have a work ethic, you have a logical system of care. Patients come first. You're not burning your therapists out, and you have a high retention rate. And these are the key values." They look at the value a lot differently as opposed to just money, because that doesn't buy happiness, and it causes a lot more stress in their life because they're coming to me and they really are damaged, and we really have to make sure we teach them how to come back to us, and realizing that when they see 7 or 8 patients in one day, they're almost like this is before lunch for them before, and now they're getting it for the whole day. Because now the patients are better too. Patients recognize the fact that they're getting better, and the patient and the therapist responding because now they have more joy and they have more energy to treat their patients. So it's been a very effective way to treat patients.
So the reason why I wanted to ask that one is that it has been an experience I've had with a colleague. I might have mentioned this earlier. In a startup I'm working on, he's a GP or a family doctor operating in the UK at the moment, and he was the one who introduced me to a phrase called heart sync patients, where you have a patient come in and you know what it is that they have, and your heart just sinks at the thought of going through another one of these issues again, where you just have to go through the process because the system they work within, he's like an automaton. The patient comes in, he tells them exactly the same thing that he told the patient earlier with the same condition. And I think it was Tim on an earlier panel who said, they're basically collecting data, they're collecting instead of connecting. And that's what's making him feel not strictly burned out, but heading that way. And so it did seem to me that one of the sources of burnout is when we start treating our medical staff like widgets, like a machine, and we start treating patients like units that need to be moved through or something like that. And so we need to look at some way of helping people go through this process in a more humane way. Before we move on, Heinrich, was there anything, with what's been said so far, was there anything you wanted to add at this time, or are you okay to move on?
One point is there are different timescales of recovery that is needed. So recovery is needed on a weekly basis or year basis, a daily basis or even lower. Every year, every hour you need some recovery. And this is also hard to introduce in a system where this was not usual.
I know that you said that. It reminded me, you've spoken about a thing called resilience, which is possibly something we could use to address burnout if people were more resilient. Can you tell us a bit more about resilience, how it relates to what you're just saying with regards to the timeline?
Yes, okay.
And if there is a way we can actually improve it.
Yeah, I think it's connected. The term resilience was from Aaron Antonovsky. He observed that under very aversive conditions, like in a concentration camp, some people get traumatized and others not. And he wanted to find out what is the difference and how can resilience be improved or learned. Is it a trait? Is it a personal trait? Are you born with a certain amount of resilience or not? And there, I think you...
Well, I guess, your opinion, is our resilience innate, or do you think we can improve it?
Partly. You bring something with you, and it can be changed, I think.
Yeah, a very diplomatic answer. I think you had something to say on that, Laurie.
Well, I just take everything to the physiology for the most part because we can measure it. And we know the definition of resilience is not just to bounce back. We really want to prevent bouncing back, but to prepare for, adapt in, and be able to bounce back in the face of stress, challenge, and adversity. And because we're energy systems, literally at a cellular level, I mean, the mitochondrial damage that happens from burnout is decreasing the amount of adenosine triphosphate that we produce. That's our currency, right? Because of this emotional toll. And so if we look at resilience from a physiological perspective, it's really intelligent energy management. And how do we learn how to intelligently manage ourselves as an energy system? We know that baked into our DNA, we have the ability to regulate our neurotransmitters, our hormone levels on demand with practice. So this is going to take a much different level of awareness around being a battery system and being able to intelligently manage that. And that's not just on the individual, that's also on the organization and the system. This isn't just all on the person. So I steer away from the definition of resilience being something around character or personality. And it's really all about how much self-regulatory capacity do you have to deal with the stress at hand. I mean, a good example, there are some Monday mornings where you wake up and you had a great night's rest and a restorative weekend, and a couple of things come your way that are hard. You manage them. You're resilient. But you slept 3 hours on Sunday night and you had a rough weekend, you can't handle it. So it's really about energy management. And this is some of the work of HeartMath Institute as well. That's done a tremendous amount of research, a lot of literature on this.
There was a 2017 study in the U.S. on 1,000 physicians, and I think there was 43% of the physicians identified have at least one level of stress factors in their life, right? Because the system is broken and they're inundated with a lot of patients that they can't handle. So the resilience factor is way low because of that factor. So that's something we have to do. That's why they're seeking wellness. These patients are now, it's a $6 trillion business. Over $450 million were spent, billion dollars were spent last year in wellness products and services in the U.S. because they're seeking services outside the system to help them cope with their own issues from burnout at their office. So we're burnt out, and so are the patients we're seeing.
Was there anything there that you wanted to just make sure? Yeah. Speaking of the resilience, in your experience, James, have you found some people who've come to you have displayed more resilience than others, or have you found any insights into how some people have been able to develop more resilience just within themselves?
With our staff, you mean?
Yeah.
I have seen, like I said, I think if I can identify that, I see patients that have worked in bigger healthcare systems are the ones that I think are the least resilient because they've already been down that road. And so they're just won't go into a heavy caseload. We don't push them that way. The ones that maybe worked in mid-tier positions, a little bit older therapists, have been down that road. They know how it works. But the younger therapists, I think it's ingrained in our healthcare system of the education system of making sure that you identify these things early. So I feel like there's an age gap there, and what type of system you worked on before you came to work with us.
So I guess to clarify that, one of the things, if you could develop it in somebody, would be that ability to sense when you're starting to get low on energy, and then I guess have that willingness to say, no, I need to correct for this. My energy is getting low, I need to take action to prevent that, which I guess might have the look of resilience, but to be pedantic, you might actually call that robustness, where you realise something's happening, you take corrective action and you stay on track. Would that be reasonable, given what you've seen?
I agree. I mean, we try to identify it as much as we can. I think I think we've done a pretty good job, but I'm a small-scale operation with about 75 employees. But larger scale, I don't know if we could do it that much, but I feel at this point we've been managing pretty well.
Go ahead.
That's also a really nice example of mindfulness, is to be able to pause and track yourself. Can I self-assess and know when I am out of sync, out of alignment, and I'm really heavy in my sympathetic nervous system activation right now. You know, I'm in fight or flight. I need some active recovery. And even if that active recovery is 60 seconds long of breath work, right, to balance that autonomic nervous system back out, and pull on the activation of the frontal lobe, which is required for, you know, the cognitive work and the emotional labor that's involved in healthcare.
I want to add something now. We're at the startup that I'm involved with. One of the things that we're looking at doing is try to automate those parts of work which might be the more taxing ones. So for example, my GP colleague who said he feels like he's disconnected from reality when he just goes on autopilot and starts telling somebody with high cholesterol that you're meant to eat less fat, and then he gives them all the rundown on things they should be eating. He said in reality what he would rather would be if he could give them a very quality piece of information. It could be an online video, it could be a pamphlet, he's not entirely sure, but then he could spend that time actually connecting with his patient, understanding why they might have these challenges, actually working with them. And so I do think that we do have an opportunity to look at the way staff in healthcare work, understand those tasks that might be the more taxing or the soul draining, the things that can cause burnout, make you feel as though you're not a part of a community or something like that, and then automate that to make it done sort of very quickly so they can focus on connecting. That's something that I guess I'm sort of pursuing individually, but I wanted to put that idea to the other people on the panel, and you're more than welcome to criticise it if you wish, but also if you had any other insights or thoughts on what you've come across in the past to help prevent burnout in the first place from an organisational perspective, because I think up until now we've been talking about the individual and how the individual can take breaks. There was that comment there about making sure people do take a break. And that's once again managing the individual, but anything organisational from anybody here that they can think of?
Well, we've you know, the holidays, for example, sometimes it's when they fall in the week, we've kind of made a pact with our therapist now that if we're able to meet certain metrics, the day after Thanksgiving, you're home. We're going to have our patients come in the 4 days of the week, and so they are motivated to get a 3-day weekend. Mm-hmm. So we kind of like, and so we've seen the statistics on our numbers over the last 3 years that once we threw out that Christmas or New Year's, I think those days we're able to still be efficient. It's still a business. We have to run as a business, and we're as efficient as if we were open that day. And it's not a grind to them any longer, so they feel like that's a motivation to them. We also have a wellness program. We provide wellness to our patients. We let our therapists do the same thing. Sometimes I'll take a couple therapists. Sometimes if I feel like they're tired, they'll go through a wellness program for a half a day and let them check out because they're important to us. I'm invested in them and they know it. Okay.
I think offering coachings in a firm is very helpful because how we recover is very different from person to person. So it's worthwhile to have one-to-one coachings to discuss this. And
I like the word coaching because I think it shows that you've reached a higher level. And if anybody, and maybe this is why surgeons and doctors are notoriously difficult to deal with, they don't want to feel they're being spoken down to. But if you've got a coach, it's that coach relationship is more that you are at a high level and they're providing a different perspective. And it's also a more Socratic sort of approach, which I think might go down well with people. Laurie, you look as though you're itching to say something. Or, oh, no, just looking very engaged. Excellent. Okay.
I really think that prevention and intervention strategies are pretty similar, really. So expanding that self-regulatory capacity, and with things like mind-body medicine practices, mindfulness, meditation, exercise to help manage the cortisol levels, yoga, breath work. A lot of the biohacking tools can be really helpful, depending on what's going, how far they are. Depending really on whether they're more in that fight or flight or shutdown mode. The strategies can look a little bit different. But even some psychoeducation. I think that the understanding of burnout, there's not enough nuance in it. It's again this idea that I should be able to handle it and take care of and be able to manage this load. But it's really, it's just how our nervous systems are designed. And when you take it down to the physiology, it brings in more compassion and understanding that this isn't a character flaw of me. This is my technology doing its job. We have this inner technology, right? And I think when you come from that perspective, it's not about something's wrong with you. It's about the battery broke down, right? And so social support too, good old basic social support, because we're activating that mammalian caregiving system. That parasympathetic branch of the autonomic nervous system, which is incredibly buffering and anti-inflammatory and toning the vagal nerve. Because we know with burnout that there's a loss of vagal tone because of that, it's toxic traumatic stress, basically. And so there's that overactivation of that sympathetic branch of the autonomic nervous system, and then oftentimes shut down. So social support and not feeling isolated can be really helpful. Something else, just biofeedback. I think I mentioned that earlier, wearables, but biofeedback so that people can see the objective data of what's going on in their nervous system, because they might not be self-assessing accurately. We lose that ability to self-assess. A good example is in those high threat, high stress environments, we lose a key skill called interoception. Interoception is just knowing what's going on with inside your body. And I don't know how many social workers I've worked with, nurses I've worked with, they said, I don't even know when I need to go to the restroom or eat or drink. That's a serious loss of interoception. And of course, decreased interoception correlates with decreased ability to be empathy and kind as well. So just doing body scans, for example, can be really helpful. A lot of the tools and strategies that Heather talked about this morning in her self-care, but really integrating in active recovery throughout the day. You don't charge your cell phone once a year on vacation. We cannot do that to this technology either. It doesn't work that way. Yeah.
Yeah, I think that's creating an organisation where people are essentially maintained. At this stage here, as you can see, it's a small panel, but we've got a lot of expertise out here on the floor. So I'd be very interested to hear, not only if you've got questions, but if you've got any insights, if anybody's come across any methods they've used to prevent burnout, manage staff, or any questions you want to ask, by all means, jump up and ask away.
She's ready to go.
She is indeed.
Okay.
You got it.
Hello? Yes, good afternoon. Thank you for the beautiful topic. Actually, burnout is a quite challenging situation. It cannot be prevented because, of course, we have different interpersonal variation in the character and the limitations and the culture, social background, so many factors. And I do believe maybe if the staff, all the staff in the health sector, they should be screened initially by the clinical psychologist or by the psychiatrician, so they will know what are the limitations, how, like for example, will understand what is the background when it comes to any situation. While this staff might be in a state of burnout, will understand what was the baseline for that staff. So I want to say, what about having a regular screening for all the staff? We should not wait for the burnout to occur. We have to do something about, even if we can do that privately, like to have a private connection between the staff and the clinical psychologists, for example. And another point I want to discuss also, implementing regular education, because some people, they don't understand when they will be they don't understand this is a burnout, like they have the lack of insight. They don't understand what is the psychological background or the mental background of the thing that they're having. Like earlier you said, like for example, we can monitor tachycardia, for example. But tachycardia, it doesn't mean it's a stress. It can happen if you are happy, if you are sad. Any situation can bring up tachycardia. But for me as a staff, for example, if I'm a staff, I have to know which level of tachycardia, which level of what symptoms might be reflecting a burnout or when I will be under stress.
So before you run away, I guess you spoke about screening, and to my mind that seemed like having regular surveys, following
Yes.
the stuff. Or are you thinking of something a bit more comprehensive where it's almost like a
Yeah,
one-on-one?
it should be like mandatory.
Yep.
I believe. Like
Yep.
for example, I'm gonna work in that hospital as a baseline records. They have to screen my abilities, my limitations, my beliefs. How do I think about stress? Because in the health sector, we always use the term. We are instructed to understand that always the patient is right. We have to put ourselves in the patient's shoes. And of course, we have to do it because this is all linked to empathy. If we will not show empathy, we will not be able to manage our patient, right? But this will bring so many stress on the staff himself.
Gotcha. So I think there's a bit there, but would anybody like to respond to that first?
I think she was talking about even a clinical psychologist to be involved. Is that correct?
No, I mean, not a must should be a clinical psychologist, like maybe a coach or a person who knows how to manage mental health. Can be, for example, a nurse who can be educated about the mental health. Any person can do it, whoever is available, based on the availability, but it should be done.
Yeah.
We should not wait for the staff, to burn out. Another thing, just want to add.
Sure.
For example, I am a staff and I have a manager. My manager should know how to distribute the task, how to give me the task according to my abilities. He should know what is my limits. So if there is any problem, for example, even me as a doctor, if I find that my nurse is having a problem, I can help with switching rules, do something, do that. So we have to understand our community, we have to understand our staff, we have to be connected together.
Yeah, it's hard to argue with that, but were there any...
I think, just basically clarity, like part of the onboarding process should be, she's describing an onboarding process, and part of that would be the clarity. Having clarity of your position, what your expectations are, and here are expectations as well, and going through the list of things that potential. Burnout should be discussed from day one, because it's real. It should be talked right during the onboarding process. They know that we are empathetic towards them, we recognize it, and we will be there for you, and here's what our expectations are. So.
Any other?
No?
Well, I just really appreciate the focus on self-awareness too. So like third-party awareness, being able to track, and I see some signs here. But also I think what's really important, and that's why really understanding what's going on inside of you is so critical to be able to stop.
The lack of insight is very important.
Yeah.
You have to understand what's happening to you, because if you cannot express, someone else cannot help you, right?
Right.
Nobody can help you if you cannot understand what's going on.
Right. Yeah, thank you for that, yeah.
Hi, thank you for your discussion. I'm wondering, we live in a digital age, a lot of tooling, a lot of wearables, we can work from home. I'm wondering, is burnout just the price we have to pay for all our introduction with all kind of digital solutions? Because then we are always on culture, constant connectivity, loss of human interaction. What are your opinions on that? Is there a connection? Because on the one hand, I think, okay, digital is okay. We have to introduce it. It's here. We cannot ignore it. But on the other hand, I see a lot of nurses on our polyclinic. They got burnout because we introduced a kind of kiosk where the patient check in. There's no interaction with the nurse anymore. We have buildings, very efficient, but the nurse doesn't see the doctor anymore because there are two ways into to the room. So I'm wondering, can we turn the tide?
I think it's the use of this technology, and probably we should change some rules. Yeah. Not to forget about technology.
Yeah, I think there's a few parts of it. In Australia, they've recently introduced regulation of the right to switch off, which is your right to disconnect from any sort of social media or anything from your employer. so you can connect with your family, things like that. This is a bit of a tangent, but it was something we were talking about earlier. I read this in a book called Come As You Are, which is actually about female sexuality. But it had a section where it said what we often need is a break that we were talking about earlier, and a physical exertion to actually be able to remove the stress we have, and then also come back to our tribe or come back to our herd and connect with people. And I think what you've described there is a situation where a person is continually being worked. They're not getting a chance to take a break and recharge, and they're not getting any social interaction either. And I think that would definitely push you towards burnout. And I think from an organisational perspective, if you can set the system up so you can still use the technology because it's there, it's useful, but be able to maintain you've got that social connection, that chance to take a break from what you're doing, a bit of physical exertion to get the body working the way it's meant to be working, I think that will help. But I understand completely that situation you're talking about where people are just kept at this sort of chronic low level of stress until it just slowly builds up and they burn out. Yes, I understand.
Yeah, just a couple more thoughts. I don't think that technology is our issue. I think it's the level of consciousness. So until we consciously evolve, we're not going to be able to handle this technology, right? And then how we label it. Is the technology something that we can use to make things more efficient, to do some of this like menial task work so that we can do the healing work, right? Which comes through co-regulation, even more than the treatment interventions. You know, we hold a healing space for somebody. We know that from the literature that that's a big part of the healing role. And so when it gets used for healing, I don't think it can't be used for healing, but I think if it's primary use for that, then it's mislabeled. But I think also this we're not using, I'm going to say the word again, I know it sounds weird, but we're not using this inner technology the way that we could because we have really heightened perceptual and self-regulation capacities that we're not tapping into, we're not using those. So if we're getting all of this incoming stimuli, what is self-regulation? It's a space between stimulus and response, right? But if there's no space between stimulus and response, we're in reactive primal mode all the time, and we're just using those circuits instead of our higher capacities. So it's a paradigm shift into seeing, I think, technology differently and evolving consciously so we can use it in a more advanced way. I mean, we created it. We created something that if we're not careful, it can control us, right?
Yeah, thank you.
So we're at the 1 minute mark. Do you need us to wrap up now, or? Okay, so yes, go ahead, please.
Oh, thank you so much for bringing up this topic. I believe burnout is extremely important. As a mental health provider, I have a question for you all. So you mentioned that empathy would lead us to burnout, but compassion wouldn't. So I want to ask, how can we shift us from empathy to compassion? Any practical skills or method that to help healthcare provider shift from empathy to go to compassion? Thank you.
So I'd certainly say I'm aware that there is compassion training available that can help with that. But when it comes to the specifics, I'm thinking somebody else on the panel might know more than I would. Yeah, I was thinking that as well.
Really, training. You can literally train compassion as a skill, and also self-compassion as well. So like Kristen Neff's work, she's really a pioneer in the self-compassion movement, and she's got some beautiful self-compassion skills, and she's taking that into healthcare organizations as well. So people need to understand that there's a difference, there's nuance between empathy and compassion, and they need to understand what that feels like when they shift. It's a physiological state, and so when they shift into that state, things change. Heart rate variability goes up with compassion, for example. The vagal activity is increased. And so even doing practices that increase the parasympathetic nervous system can be useful. But the most widely used compassion skills training is LKM, loving kindness meditation. It's the oldest and most widely used, and it's researched back. We got more literature coming out on that. Doesn't mean there's not other compassion practices, but you literally have to practice it. And honestly, 10 minutes a day throughout the day, even just, it doesn't have to be concentrated, is a really, really big game changer in learning how to switch from empathy to compassion, just knowing the difference. Yeah.
Okay, thank you so much.
So that'd be LKM. if anybody wants to get into it, look up LKM. Thank you. Thank you for those great questions and insights. That was much appreciated. Presentations are always better when the audience gets involved. Thank you to the panel. I enjoyed that. And thank you, everybody. Once again, enjoy the rest of your day. Take care.